practice to integrative care. Integrative medicine is the pursuit of ideal health by seeking and reversing the causes of illness, by going beyond simple reduction of symptoms. Dr. Huber lectures on hormone replacement therapies, cardiovascular care, sports medicine, and other integrative medicine topics for the American Academy of Anti-Aging Medicine. He's developed a highly successful Huber personalized weight loss program, which not only promotes healthy weight loss, but works to reverse issues of metabolic syndrome. Credentials, Dr. Huber is from the Ohio University College of Osteopathic Medicine. He did residency in Columbus, integrative professor from the American Academy of Anti-Aging Medicine, University of South Florida, clinical professor and preceptor at the University of Cincinnati College of Pharmacy, and the author of numerous books. Please welcome Dr. Gary Huber.
Good morning. Thank you, Eric. Is this working? Can everybody hear okay? Yeah? All right. 7:30 in the morning, you're going to hear a doctor talk about health. Right? Horrible, horrible. With that lead in, I have every right to be boring, and I promise you I will not be. If anybody gets bored and you're falling asleep, raise your hand. I'll tap dance. I'll do whatever it takes. Keep your attention. So this is a great opportunity. I'm really, really excited to be here because I was asked to talk about this very topic, something near and dear to my heart, which is we have an idea of what traditional medicine is, but does holistic, integrative, natural therapies, do they really work? And I'm going to tell you, I don't have to prove to you that they do or convince you. All I'm going to do is share with you stuff from the medical library. You ready to go to the library this morning? Sitting in the front row? And I'm going to share this information for you, and it is a Michael Jordan slam dunk. It's an easy topic to talk about. So let's just get into it a little bit. Are you healthy? Oh, okay, he's already boring me. Are you healthy, right? It's a simple question, but let me give you a quick story. One of my favorite people on the planet is my father-in-law, Tom. Awesome guy, a little bit older, got a little bit of belly on him, and a few years back, he proudly announces to me, I was just at my doctor's, he says, I'm one of the healthiest guys in his practice. I said, that's awesome. And I look in the kitchen on the counter, and there's his blood pressure medicine and his blood sugar medication and his cholesterol medication, okay? One of the healthiest guys in this guy's practice. 3 years later, Tom had a quadruple bypass surgery. So it begs the question, what does that mean I'm one of the healthiest people if I'm going in and having my vessels bypassed, right? So my background, as Eric said, is in emergency medicine. 20 years dealing with heart attacks and car accidents, and it's a great place to be because you get a great sense of what we do well in medicine. We do some really cool stuff, but it's also a great view of what we don't do well. Because my reason for leaving emergency medicine, it wasn't that emergency medicine was bad, it was just a small part of the equation, right? Classic guy, comes in, he's 55, he's got chest pain, he's having a heart attack. We do whiz-bang stuff, we put stuff in his IV, boom, heart attack's gone. We break our arm, patting ourselves on the back, look what we did, right? And that's awesome. And he goes up to the ICU, and then he goes home. But I got that same story over and over and over. That guy's coming back to me in a year and a half with his second heart attack. So what did I really do? Did I really just save his life, or did I just save his Thursday? You know what I mean? I wasn't seeing a long-term impact from what we were doing. Don't get me wrong, emergency medicine, what we do in medicine is amazing, but it's one small part of the equation. It isn't the whole story. So the first question I have for you, and I'll give you a series of questions just to see if you're with me. But what's the definition of health? Well, God, now it's really getting boring. If we go to the National Institute of Health, now the National Institute of Health is our large governing body that oversees healthcare and decides where money goes to do studies. And their definition of health is employing drug therapy to help patients manage the symptoms of their chronic disease state. Not very romantic, is it? Not very exciting. Not very Marcus Welby-ish, right? Does anybody? Yeah, see, I heard a few snickers. Somebody knows who Marcus Welby is. If you don't know who he is, you're young. Congratulations, okay? So Marcus Welby was an old TV show, and he would make house calls, and he was awesome. He would hold your hand and pat you on the back. Not very exciting. In fact, one of my colleagues, this is a quote from some printed material, the person that said it isn't noteworthy, but what he said is a common sentiment in medicine, which is it really the National Institute of Health Or based on the fact that we're disease focused, should it be the National Institute of Disease? All right, and that doesn't sound all that attractive, but that's largely true. So everybody here has car insurance, right? Did I see this car in the parking lot? I hope not. I hope not. But if I did, here's the question. Does having car insurance keep your car running well, right? Does it do tune-ups for you? Does it wax the car? Does it put air in the tires? In other words, does your car insurance keep your car healthy? No, it's not intended to. You're supposed to do that. Take that same ideology and apply it to medicine, right? Because here's what's common. We do unspeakable things to our body. We put all kinds of stuff in that pie hole. We don't exercise, we don't sleep right. And then we walk into our doctor's office, we put on that fabulous paper dress that they give us to wear. And they go, here, doc, tell me I'm healthy. Make me healthy. He can't. He can't. He's not able. He's not trained to. That's not what his job is, right? So when we talk about health and disease, they're very, very different topics. Let's take a broader view. The World Organization, the World Health Organization, defines health differently. They say it is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Well, that's a little closer to the truth, right? But our healthcare system, and I love it, and I've been a part of it my whole life, that's not what we do. We're not trained to do that. So the question is, does traditional healthcare make us healthy? And the bigger question, do drugs make us healthy? All right? When it comes to trauma and emergency care, we rock. We are awesome. If somebody chops your leg off, if you have a heart attack, if you have an emergency, the United States healthcare is #1 in the world. Best techniques, best procedures, best equipment, best training. But that's if you're in an emergency. That's if you need acute care. What about if you just want to be healthy? Unfortunately, and this comes as a shock to a lot of people, when I went to med school, and today, there are no classes teaching you health of the heart, health of the brain, health of the gut. We're not taught that. We're taught disease medicine, diseases. We're taught how to recognize diseases, and then we're taught how to change the course of that disease using two things, surgery and drugs. That's all we're taught, all right? So we're not taught anything about nutrition. In fact, in the 1950s, nutrition was taught in med school, and it was removed because some very influential and wealthy people, the Rockefellers, once again, if you're old, you have to Google that one, had nutrition education removed from med school because they didn't want it to interfere with their new investment in pharmaceuticals. Now, pharmaceuticals are not bad. They're delightful, but they're oftentimes inappropriately used. There is no class in med school on sleep and stress. You don't go to your doctor typically and have him ask you, how's your stress level? Let me help you manage that. And if you do say I'm stressed, he goes, well, here's your Ativan, right? Here's your medication to help that. We get no education in prevention, and in fact, disease reversal is not really discussed. I teach pharmacy students, and on the first day of their rotation in my office, the PDR is a big, thick book, really, really big. It has all the drugs that doctors use in it. And I'll hand it to my pharmacy student, and I'll say, now look at that book, because they know it well. How many drugs in there cure a disease? They go, cure a disease? Yeah, how many drugs in there cure a disease? And they'll scratch their head for a minute and go, not many. I said, I know, right? Now, doesn't mean drugs aren't valuable, but if we're looking at drugs to cure diseases and make us healthy, we're going to be sadly disappointed. All right, if you're not depressed enough, let me take you down another notch. 2013, this comes from the National Academies of Science, Engineering, and Medicine, and the title of their report, Shorter Lives and Poorer Health. And they're reporting us. They're talking about us. And they're saying when we look at the American public, the U.S. spends an ungodly amount of money on medicine. You probably hear it on the news from time to time, right? Our healthcare costs are rising. And yet we're one of the least healthy populations on the planet. Many people look at our culture, many people from abroad look at our culture and say those Americans are crazy. Look at them. Look what they're spending, and look how healthy they aren't, and look how they lead the world in diabetes and heart disease and cancer and obesity. So here's the big shift in our thinking. You guys, a lot of you, are involved in construction or craftsmanship of some kind. Can you drive that screw into that board with that hammer? Not well. It's the wrong tool. It can go in real easy. Grab a screwdriver. But banging away at that thing with a hammer is never going to get you anywhere other than a mess, right? And my point in this is drugs are disease tools. If you have high blood pressure, a drug will help lower it. That's great. But it doesn't affect why you have high blood pressure. It doesn't affect the disease itself. So we can't, with most corporate health programs, you go, all right, everybody get your blood pressure checked. Hey, George, your blood pressure was high. We put you on medicine. We made you healthier. No, we didn't. It's valuable to be on that medicine to lower your pressure, but we haven't done anything to address why George's blood pressure is high. This is a very curious statistic. In the US, we're only 5% of the world population. Yet we swallow 50% of all the drugs made globally. That's a crazy high number, right? For such a small part of the population. Now, if drugs make us healthy, we should be the healthiest SOBs walking the planet, right? We should be awesome. Well, let's look at that. If drugs make us healthy, we should live long. When you talk about life expectancy, this is the top 10 countries in the world in terms of longest life expectancy. Notice where we rank on that top 10 list. 30th overall, 30th. And what's interesting is you can find countries on every continent, South America, Asia, Europe, Middle East, all represented, and the US ranks 30th. That has to make us scratch our head. And look, I am not here to beat up on traditional medicine. I'm part of traditional medicine. I prescribe medications. I've been in emergency medicine 20 years. All my friends and colleagues are in traditional medicine. I'm not here to beat it up. But anything that you guys currently do in construction or safety or whatever field you're involved in, anything you're currently doing got better when you looked at the old model and said, what are we not doing well? What can we make better? If we don't explore what we're doing and see what we can do better, it never gets anywhere. Does that make sense? So we're just trying to explore the factoids and see, all right, what are we missing here that we could improve upon? Leading cause of death. Number one, heart disease. Do you know in 1920, 1930, if you go back and look, you know how many heart attacks were happening in the United States of America? Almost none. It all changed in the 1950s. Well, what changed in the 1950s? Processed foods entered the marketplace. And in particular, hydrogenated oils, man-made margarine. Remember margarine when it came out? It's awesome. It's better than butter. Butter's full of fat and it's bad for you. I could give a 3-hour lecture on heart disease. But understand that heart disease is number one, cancer number two, stroke number three, and all three of these diseases have a couple of common threads. They're all inflammatory diseases. In other words, you go into cultures or diets or subpopulation where there's less inflammation, they have less cancer and less heart disease. What do I mean by inflammation? If I had the healthiest 25-year-old on the planet standing right in front of me, and I wanted to make his body inflamed, what could I do to him? I could feed him wheat and sugar, okay? Because wheat and sugar cause inflammation in our bodies. I could not let him sleep. I could stress him out. I could make him sit on the couch 6 hours a day and never exercise. If I did those things in combination, his biochemistry would become more inflamed. And what do I mean? Inflammation means the lining of the blood vessels are irritated, the brain becomes irritated, he starts getting things like headaches more often, his joints ache, his body doesn't feel good, he doesn't have good energy. That's inflammation. And if you live with that long enough, you start to corrode the pipes in the body, which are the blood vessels, you start to see disease states, all right? So notice how I say uncontrolled sugar. You know how much sugar we eat? The normal sugar intake, they estimate, for an American, 150 pounds a year. 150 pounds, that's a lot. And the sugar that we don't see that we're eating, bread, crackers, pasta, what are we talking about? Breads are good for me, whole grains are good for me, right? TV said so. The way that we make our breads and our crackers and our pastas is with modified, genetically altered plants that didn't exist. Your great-great-grandparents didn't eat that stuff. They ate different stuff. But that stuff turns into sugar in a heartbeat. It has a unique carbohydrate in it called amylopectin A. Now I'm getting too sciencey for you, I know. But when you eat bread, it'll raise your sugar faster than if I gave you 5 sugar cubes to eat. That's weird, right? Who's talking to us about that? Our health professionals aren't. Now, a box of donuts, I got them right over here, to anybody who can tell me the answer to this question. What's the fourth leading cause of death? And there's a lot of safety-minded people in here, so I don't want to hear falling off a building, falling into a dump truck, right? That's not it, and it's not car accidents. Anybody want to venture a guess? Diabetes? That is a great guess because diabetes causes the number 1, heart disease, and diabetes leads to number 2, cancer. So yes, it's in the mix, but as a clear diagnosis by itself, it's not it. Anything else? Diet? Overdose? Overdose is down around 10 or 11. Doesn't happen as often as we think. But in a way, you're right. In a way, in fact, I've lectured the doctors and pharmacists and students my whole life. That's the closest answer I've ever heard. Because the fourth leading cause of death, holy moly, the appropriate, not inappropriate, prescribing and appropriate use of drug therapy. Now notice I didn't say inappropriate. I'm not talking about crack and meth and inappropriate use of street drugs. I'm talking about your doctor saying, take this medicine. You go, okay, I'm going to follow the instructions. Fourth leading cause of death in this country. Now again, don't leave here today saying Dr. Huber hates drugs. I prescribe them almost every day to my patients. Here's the difference. I am never going to put you on a blood pressure medicine and say, okay, we are done. We fixed you. We didn't. We just started the journey. The medicine helps get your blood pressure down. Now we got to figure out why your blood pressure's up. What are you doing to you that's making that happen? Make sense? So we put people on medication and we get this idea from our doctors, oh, I'm going to take this, how long? Forever? Okay? So, medications, problematic. The number 1 cause of GI bleeding from your gut, is NSAIDs. All right, things like naproxen and Advil and Motrin. Number 1 cause of GI bleeding. So they are a potential problem. And if you're here representing your company's corporate health initiative or human resources, your chief financial officer, understand this. Drugs are killing your company's budget, absolutely annihilating it. $40 billion spent on drug therapy in 1990. It's up to $200 billion by 2005, and only 4 years later, it's up to $300 billion. And then in the next few years, they expect it to crest over $500 billion a year on drug therapy. Wait a minute, drug therapy that isn't making us healthy, that's a fourth leading cause of death. It doesn't make sense. We've got to make sense of this. This is not criticism, this is exploration to say, well, God, there's got to be a better way to do this. Life expectancy, well, it must be going up because we're in the greatest country in the world with the greatest medicine in the world. No, for the first time in history, our life expectancy is dropping down. And when we ask why, it's because the 8 leading causes of death are all going up. Heart disease, cancer, diabetes, all these bad things. So here's the question, why would that be? Lifestyle. It goes to sleep and stress and diet and exercise, lifestyle. Got the kids and the job and the rushing, and I don't have time, so I'm going to go through a drive-through. I need 4 Cokes a day just to keep my energy going, and I don't sleep well at night. And after soccer practice, we'll just go through McDonald's. These are choices. That's all they are. They're choices. And we convince ourselves all the time. We convince ourselves, well, I have to. Or we say, everybody else is doing it, so it must be normal. All right? But these choices determine our lifestyle, and our lifestyle determines our health. Drugs can help curve our disease pathway a little, but it's never going to reverse it. So, one of my favorite personal works of art. Why? 2 reasons. Number 1, I can't imagine the brain of Michelangelo looking at a slab of granite and somehow pulling that out of it. Can you imagine? Mine would look like a stick figure. It would be silly. So that's amazing. And the second thing is, I love the human body. I've been fascinated with it my whole life. And so when I look at that perfect replication of the human body, I just think that's amazing. I think that's beautiful. Interesting story. Michelangelo, his statue David, was on loan from the Italian government about 10 years ago and toured the US. So this beautiful work of art went to all the major metropolitan areas across the country, all right, for viewing. So David was in America for about 6 months. And it created a little bit of an international incident, because by the time David went back to Italy, things had changed just a little bit. I know, right? David had gotten accustomed to Ronald McDonald and Wendy's and Burger King, and he said, this is awesome, I can play video games. So the point of this is lifestyle that takes us there. All right, so this was David's fate. He began to develop metabolic syndrome. Metabolic syndrome is just a fancy word that means everything's going up. My blood sugar, my blood pressure, my weight, cholesterol, everything's going up. These things aren't separate diagnoses. If you have high cholesterol and a belly, your sugar's up too. Your doctor may not have diagnosed it yet, but I guarantee it's there. It's hiding in the background. Lab tests don't always show it until it's advanced. All right? Well, this is a problem. So what do you think causes metabolic syndrome? I've already given you the clue 8 times today. Inflammation, right? Inflammation. What's inflammation? Inflammation is bad lifestyle, bad diet, bad things that we do. And here's the question. We have 2 options. You go to your doctor, your blood pressure's up, your heart is showing some cholesterol, and he goes, I'm going to put you on some medication. And all I want you to walk away with today is say, okay, all right, that can work, but is that medicine going to reverse my disease? Oh, no. The disease is going to go on. It may slow it down a little bit, but it doesn't change the course of your disease. Or I can say, you know what? That guy in the ER with the chest pain, he always leaves the ER with the same comment. His wife's crying, holding his hand, and he's clutching his chest. Well, he's probably not clutching it now because we got rid of the pain, right? But he says, I got to make some changes. And I saw that over and over and over and over again. And I would, in my head, say, Bill, you knew you need to make changes 10 years ago, but you didn't. It took you to get to this point for you to go, oh, I got to make some changes, right? So when you're at that stage and the doctor's saying, we need to put you on drug therapy, the other option is also very true. I can change my lifestyle. I can reverse my diabetes. Is anybody in here with type 2 diabetes? Don't rat yourself out, I'm just asking. If you have type 2 diabetes, does anybody ever told you you can reverse it? You can come off medication. If you have hypertension, you can reverse it. If you have weight, you can reverse it. We know that, right? But lifestyle is 3 times more effective when we look at medical studies, and we're going to get into those now, so get your pillows out. Lifestyle is 3 times more effective at reversing the damage of these diseases. So question number 3. Does holistic approaches, lifestyle, integrative care, does it work as well as drug therapy? I don't know. Let's go explore, all right? Now here's a study, New England Journal of Medicine. I'm going to go really fast through this part, so don't get nervous. But this is a big study, over 3,000 people, and they took 3,000 people that didn't have diabetes yet, but their blood sugar was running high, and they said, Bill, you're at risk for diabetes. You're not there yet, but you're getting darn close. We're going to put you in a group that does nothing different. We're going to put you in a group where we give you metformin, or we're going to put you in a group where we make some lifestyle changes. And the lifestyle changes weren't that difficult. The lifestyle changes were simply, I want you to change your diet a little bit, right? I want you to walk 30 minutes a day, 5 days a week. And I want you to make your diet changes such that you can lose a little less than half a pound a week over the next 6 months. Not too hard, right? Half a pound, less than half a pound a week over 6 months. And that's all they had to do. So here's the results. Diabetes onset, 11% of the group that did nothing developed diabetes in the next 3 years. Well, that was kind of predicted, right? We knew they were heading that direction. If I put them on metformin, I reduced that 11% that only 7.8% developed diabetes. But what if I put them on no drug therapy and all I had them do was walk, change their diet minimally, and lose a little bit of weight, on average about 12 pounds over 6 months, not a lot. 4.8% of the lifestyle group went on to develop diabetes. That's half of people that did nothing. And it's far better than what the drug group did. And here's the kicker. Only half the people in this group were compliant with the therapy. In other words, when they tracked them all down and they said, how many days a week did you really walk? Well, really only 2, right? How much weight did you really lose? Well, I only really lost 4 pounds. So half the people in the group were non-compliant with the therapy that was the best performing in the bunch. That's crazy. That's crazy, right? So what about weight loss? The placebo group, no change in weight. The metformin, hey, they lost 4.5 pounds. Awesome. But the people that made modified, small, simple lifestyle changes lost little over 12 pounds. Don't believe that study? I got more. There's another study that did a very similar approach, but instead of saying how many people went on to develop diabetes, they looked at all the people that got diabetes. How long did it take you to get here? All right? So they found that lifestyle changes in that smaller population that went on to develop diabetes, it took them 11 years for them to progress to diabetes. Versus the group that was on metformin, the ones that got diabetic were there in 3 years. So once again, no matter how you slice it, lifestyle changes reduces your odds of getting diabetes. It delays diabetes if you're going to get it, and it reduces the intensity. And in fact, the lifestyle change group had a 58% reduction in the number of people that went on to develop diabetes. The metformin group was not as good, 31%. And lifestyle changes are essentially free, which I have always found to be very popular. Medications tend to cost money. So, real life example, Paul did that. Paul took on a 6-month educational course, a didactic program that taught him about lifestyle, taught him about sleep, educated them about benefits of foods. No caloric restriction of any kind, and you really can't tell much. Paul's got a little bit of a punch, not big, but he's a type 2 diabetic. He is on insulin, okay? And all he did was change his diet a little bit, learn about his health, make some improvements in his sleep patterns, get a little bit of exercise, and this is what happened to Paul in 6 months. His paunch is gone, but more importantly, Paul's off insulin. Within 2 weeks of making lifestyle changes, he was off all of his insulin. That was the first drug to go. And then other drugs started to fall off. And by the end of the program, he was saving $700 a month in drug costs. Now, his company was delighted. Paul was even more delighted. No more sticking myself with the needle, no more diabetic. And 80% of diabetics die from heart attacks and strokes. Well, if I'm not diabetic, that risk goes away, right? So this was pretty simple. And he had a few quotes there. You know, no caloric restriction of any kind, but he learned to like some new foods. Foods that he had known about but wasn't eating, he began to change. Basically more vegetables, healthy fats. And he made this comment. He goes, food is plentiful on this earth. We don't need to muck it up. We don't need to process it. If I get back to real foods, whole foods, I do much better. So this is a little sidestep because it's such a big topic. I don't want you to rat yourself out, but if I asked how many people in this room are on a statin, I will give you my car if there's nobody in this room on a statin, okay? I know there's a good number of us out there on that. So let's explore that. And let's ask the simple question, does it work? Is it beneficial? Well, statin drugs cost the U.S. $29 billion a year. Wouldn't you rather be in the statin selling industry? That is amazing, $29 billion. In fact, there's a documentary called The 29 Billion Reasons to Lie About Cholesterol. There's books written, The Cholesterol Hype, The Cholesterol Lie, all those books, right? Because it's real. The whole idea that we need all these statins to be healthy is not supported by the evidence. This is the largest study on the planet, okay? 4 million people were studied in this study. If you look at all the studies we have in the U.S. on statins' impact on cholesterol and heart disease, there's about 25 large-scale studies that we always point to. The WOSCOP study and the PROSPER study and the Jupiter study. If you looked at all of those studies combined, there are 5,000, 10,000, 25,000 people. All those 25 other studies that were done by the statin companies to show how good their drug works total maybe 190,000 people. This is 4 million. Let me ask you a question. Would you rather make $190,000 a year or $4 million a year? That's the disparity. Huge difference. And this is unbiased. This is not done by a statin company. So let me ask you, if you walk onto a Buick dealership car lot and you ask the salesman, what's the best car in the world? Oh, it's a Buick. Yeah, I'm pretty sure it's a Buick, right? And if you ask a statin company, what's the best way to stop heart disease? Oh, it's statin. Statin's the best way. But when we look at it critically, here's what we did. 5 years, 1, 2, 3, 4, 5, they simply tracked the use of statins over time. Statin use tripled. Over a 5-year period, we tripled the number of statin prescriptions given to the population. And then we looked at, all right, now that we've done this great thing, we put them all on statins, I'll bet that heart disease rate's going down like a rock, right? Heart attacks in men, relatively unchanged. Heart attacks in women, maybe even a slight bump up. Deaths from heart attacks in men, deaths from heart attacks in women. If our statin use is tripling, shouldn't our change in heart disease be dropping like a stone? It's not. And again, this is the biggest study on the planet. It isn't that statins are not good. Some people need a statin. If your cholesterol is through the roof, you need a statin. But here's the paradigm. Does cholesterol cause heart attacks? Oh, he's shaking his head, yes. He's setting himself up for the big fall. Cholesterol does not cause heart attacks. You've heard that your whole life. Back in the 1950s, there was an initial study. We fed eggs to rabbits. Does your rabbit eat eggs? Mine does not. If I feed eggs to a rabbit, and then the rabbit develops heart disease, we went, aha, eggs have cholesterol, and cholesterol causes heart disease. That's where that started. It was a bad experiment. It was badly designed and poorly interpreted, right? You don't feed eggs to a rabbit. Rabbits are herbivores. They have no ability to digest cholesterol. We're humans. We're omnivores. Our liver makes 1,000 milligrams of cholesterol every day. Well, why would your body do that if cholesterol is bad? It's not bad. Anybody in this room have testosterone? I hope so. You make testosterone out of cholesterol. Do you have cell membranes? Yeah, they need to be repaired. They're repaired with cholesterol. So the idea that cholesterol is somehow a dangerous voodoo that God put in our body to kill us, that's crazy. That doesn't even make sense. It's what? It's what am I doing to my cholesterol? Am I oxidizing it? How do I oxidize it? Go back to the first 5 minutes. Inflammation. If my body's inflamed because I eat a ton of sugar, it's going to oxidize that cholesterol. It's going to damage the blood vessel. That's heart disease. It isn't dropping cholesterol, because in this study, they dropped cholesterol like crazy with statins. Didn't change heart attack rates because we didn't address the cause of heart attacks. Does that make sense? All right, enough science. Oh, more science, damn. So the American College of Cardiology, the American Heart Association, 2018, they came out and they said, you know what, we're recommending that we give statins at a higher dose. Let's take cholesterol even lower. Wait a minute, it didn't work over there. Why is it going to work now? In their own report, and I boxed it for you to make it easy, they 70-page report on high-dose statin use. No significant reduction in coronary deaths. The American College of Cardiology said increasing cholesterol or increasing statin dose to high-dose use didn't stop any more heart attacks. You know what we're going to do? We're still going to recommend it because it's the only drug in our bag. It's the only tool in our bag that really works well. I'm not going to get into all this math. They tried to contend that there was a 15% improvement in heart events. There wasn't a 15% improvement. There was a 0.8, less than 1% improvement. In fact, if I put you on a statin drug, I have to put 1,000 people on a statin drug to try and stop 22 heart attacks. If I had a new antibiotic to treat strep throat, and I said, this is an awesome drug, I treated 1,000 people with strep throat, and 22 of them got better. Really? That's not very impressive. So, this is the bigger question, is there a more natural way with less risk? Because when I put you on a statin, I've increased your risk of developing diabetes. Well, wait a minute, that doesn't help me at all. So, can I find something? And remember, I do prescribe statin drugs. small doses, and I work to get my patients off of them because long-term they're problematic, okay? But this is a group looking at the Mayo Clinic, pretty famous, people have heard of it, and they said, we're gonna put people on a statin at a high dose, and then we're gonna try this alternative therapy. We're gonna see what the impact is, okay? So 40 milligrams of simvastatin, which is Zocor, compared to alternative therapy. And the alternative therapy was pretty mild. I'm going to put you on some fish oil, something called red yeast rice, which is a natural food product. It's a supplement. I'm going to teach you a little bit about exercise. I'm going to give you some education, just going to talk about health and life, and we're going to have some impact on nutrition. All they did for nutrition is they put them on the Mediterranean diet, no caloric restriction. Eat as much as you want, but eat from the Mediterranean palate, okay? Results, the alternative effect and the statin effect. Let's go to the top one, weight loss. Well, when I did that alternative approach with no caloric restriction, the average participant in 12 weeks lost 9 pounds. Damn. Statin group gained a pound. That's not good. How about blood sugar? In a lifestyle approach, my blood sugar went down 1%. This is only 12 weeks. So what if we did this for 6 months or a year, right? Went down 1%, blood sugar went up 2%, and that's common. We see people on statins, the longer you're on it and the higher the dose, the greater your risk for diabetes, because it has 3 different mechanisms to interfere with your blood sugar regulation. So it's not great. LDL cholesterol, this is what statins are designed to do, lower your LDL. And they did, lowered it 39.6%. The lifestyle treatment did it even better. It did 42%. And then lastly, triglycerides. Triglycerides are the purest form of fat in your bloodstream. You need them, you want them. But if your sugar is high and your insulin's high, you don't burn triglycerides. And when triglycerides are high, you're trending toward diabetes and you're trending toward a bigger pant size, okay? And with the lifestyle treatment, they dropped triglycerides 29%, while statin therapy increased triglycerides 9%. So let me ask you, which one of these do you want to be on? Are you willing to change your diet a little bit without caloric restriction, take a little fish oil to have this kind of an impact? So what's the real cost here? What is the real cost of having heart disease, and what can I do about it? In this study, this is the largest study on the planet looking at this, 2010, over 12,000 people, and here's what they did. Big insurance company on the West Coast said, you know what, we're going to look at anybody that comes into the hospital with a diagnosis of chest pain or any concern about heart disease, whether they had a heart attack or not. If it was a cardiovascular heart-related admission, we're going to track those people to infinity and see what happens, all right? And what they found was if you had one visit to an ER because you had chest pain or if you had a heart attack or any kind of cardiovascular diagnosis, your employer was going to be very sad, right? Because now it costs on average almost $19,000 per year for your appointments, your drug therapy, your rehab, or any other stuff. Now this is looking at all patients. Patients that just had simple chest pressure that went away, patients that went on to have a heart attack, all right? That's not cheap. That's on top of whatever your insurance premiums are. And if you went back in the hospital for a second event, the cost of taking care of you went up to $62,000 a year. Well, that's not good. I'm already spending $18.9 on Bill because he was in the hospital for chest pain. Well, Bill's also diabetic. Add $10,000. He also has depression. Add $9,000. He's overweight. Add $2,000. And if he's older than 65, add $2,000. That's $45,000 a year. Boring, right? But that's the reality. That's what's crushing our healthcare setup. But here's the big takeaway. If you had chest pain and you went into that hospital and they said, okay, you got a little bit of a problem, we're going to put you on a statin. And you said, all right, I'll take my statin and that's it. I'm just going to keep marching forward with my lifestyle. I'm not going to change anything. The odds of you having a second event are high. And in fact, if you have a heart attack, your life expectancy is now 5 years and 10 months. The average life expectancy after your first heart attack is 5 years and 10 months. And in this study, if a patient came back in for a second visit, for a second cardiac event, the cost of their annual care was 4.5 times higher. What's the moral of the story? Don't go in the first time, and sure as heck don't go in the second time. Do something to derail. Do something to change where you are. Let me share with you, this is my good friend Bill. Bill's a fireman and an awesome guy, and if you met him, you would love him. And this version of Bill came to me at 58 years of age and said, I don't think I'm going to be alive past 60. I said, Bill, you're 58. He goes, I know. I don't think I'm going to be here 2 years from now. I said, why? I feel that bad. He goes, I'm a fireman and I can't do my job. I can't lift a gurney. I get short of breath. My joints ache. I feel like hell. This was him. You know how long it took to get from there to there? Huh?
6 months.
6 months? Good guess. 10 weeks. 10 weeks. All right, what happened to Bill? Bill came in 224 pounds, didn't exercise, fireman. Look at his blood pressure, 160 over 110. That's high, and that's on medication. His cholesterol was 277. That's high, and that's on a statin medication. His blood sugar wasn't diabetic yet, but remember, we don't treat diabetes. We don't treat pre-diabetes. We wait for it to become full-on diabetes, and then we jump into action. So what was being done for this? Nothing. He came and engaged in a 6-month lifestyle curriculum education. He didn't come in for drug therapy. 6 months later, first of all, he lost 49 pounds in the first 10 weeks. He started exercising a small amount. I gave him a very complex exercise regimen to do. I'll demonstrate it for you now. You ready? That's it. I had him walk. When you're really big, it's hard to exercise. He lost 49 pounds just walking. Blood pressure down to 110 over 70. When you lose 49 pounds, you know what leaves your body? Inflammation in buckets, right? Blood pressure's down, off medication. Cholesterol is down to 155, off medication. How do we justify that? How can he be on medicine and have terrible numbers and be off medicine and have better numbers? He changed his lifestyle. He changed his diet. He lost weight. He dropped inflammation from his body. His joints don't hurt anymore. His chiropractor does not like me at all because he doesn't need to go to the chiropractor anymore. This slide Bill made for me. He goes, Doc, I know you talk a lot. Well, he meant speak. I do talk a lot. He said, I made this slide. I want you to show people what happened to me. So Bill made this slide. I did not. He said after the program and coming off med, he saved $60 a month, $720 a year because he doesn't need those meds anymore. $500 a year, never qualified for that health benefit you get if your blood pressure and heart rate are in the right zone. He's in the right zone now. So he's saving $500 a year doing that. His chiropractor, he says, I don't need to go to him anymore. I used to spend about $1,000 a year going to the chiropractor. I didn't treat his back pain. His back pain went away. Why? When you lose weight and you kick inflammation out the door, musculoskeletal, joints, knees, feel better. Life insurance premiums are going to go down. We don't know yet. Just going to go back and look. $10,000 he estimates he has spent on kidney stone treatments. He's not going to have kidney stones anymore because he's not doing the things that lead to kidney stones. So we don't know how much money that's going to save him. Fewer illnesses. And I love this one. He's saving $912 a year just not drinking Diet Coke. Bill was absolutely profoundly addicted to Diet Coke. He would make the squad pull off into a gas station to get a case of Diet Coke on their way back to the squad house. Okay? So he's saving $3,100 a year plus unknown savings, plus the quality of his life is different. And do you think his employer's happy? Hell yeah. First of all, he's able to do his job better. Secondly, he's not spending a lot of money on drugs. And the risk of him going on to have that heart attack, he's that guy that costs $18,000 a year, that could be $61,000 a year, but not anymore. The odds of him having that second event dramatically reduced. All right. Lastly, what is the most expensive line item? If you're a company, if you're a chief financial officer or human resources, and you have a company, what costs you the most money when it comes to healthcare? First of all, it's been in the news. Some companies have trouble staying in business because they can't afford the health care. Okay? So, this study was done at Harvard Business Review. They're pretty well known, pretty reputable. And they looked at Bank One, and they wanted to see where all the money was going. Now, these are basically office workers for the most part, right? They wanted to see where the money was going. Notice this line here. This is all the money they spent. This line, above that line, reflects direct medical costs. Doctor's appointment, physical therapy, medication, okay? That's a pretty small piece of it. Where's all the rest of this money going? Well, some is short and long-term disability, some is absenteeism, but this ginormous 63% block of all the money that is attributed to healthcare expense is presenteeism. And if that's a new word for you, presenteeism means I'm at work, but I ain't working. I'm at work, but I'm asleep. Or I'm at work, but I move so slow because my body hurts so bad. It's just what it sounds like. I'm at work, but I'm not getting stuff done. That's a huge block. So let's look at a study. We took 135 employees, we engaged them in a 6-month lifestyle curriculum. And we measured their brain. How? We simply asked them some simple questions. How's your memory? How's your focus? How's your ability to make decisions? How's your mood? You ever go to work and you're in a bad mood, you get much done? No, you just bitch at everybody, right? So your mood, how your brain, do you have a headache? How is your energy in the afternoon? How is your ability to solve problems? We asked them these questions, we had them rate themselves, and we scored it. And then 6 months later, we did the whole thing again, after they've had 6 months of education and a chance to change their lifestyle. 49.5% improvement in their brain. Now, if you're a CFO, a CEO, human resources, how would you like your employees to be 49.5% more efficient? Yeah. What does that cost? What does that mean in dollars? Well, work productivity and presenteeism. In this study by Harvard, they said it wasn't unusual to see somebody lose an hour and a half every day of unproductivity, all right? They just weren't getting stuff done, or their productivity level really dropped. If you pull that out over a month, that's 32 hours, and if you're a $65,000 a year employee, that means $12,480 was spent and given to that employee, but you got nothing in return. There was no productivity, right? What if we reduced that by 49.5%, got your brain functioning better, your energy to be better? So if you reduced it by 49%, you would be, as an employer, returning 16 more hours of productivity, or you'd be gaining $6,000 in productivity. What if I did that for 100 employees? $600,000 a year of gained productivity, or said a different way, lack of loss, right? Your employees are just doing more. They first of all, they feel better, they function better, they interact with their coworkers better, their mood is better, because when you're inflamed and you have headache and backache and heartburn, you're not fun to be around. You're not. You don't feel good. Leave me the hell alone. Bring me a donut. Right? Cup of coffee and a donut. Yeah, let Larry take care of that. I don't want to do it. So, meet Greg. From dud to stud. That's him at home, but that's also him at work. He admitted to us that he sleeps every day at work. An hour, 2 hours. In fact, cubicle mates or other office staff will sometimes go over and go, Greg, you're snoring. Wake up, man. He's snoring at work. He's out, right? At least an hour a day, if not 2 hours. And he goes, after lunch, he goes, I'm worthless. What do you think his odds of promotion are? Not good. He may even lose his job. That's him coming back from Reds Fest 8 months later, did the 6-month curriculum. Got smart, changed his diet, changed his lifestyle, got back to exercising. Here's what happened to Greg. He lost 60 pounds in 6 months. That's huge. That is life-changing. How much inflammation left his body? How clear is his brain thinking now that he's not lugging around 2 babies, right? He was falling asleep at his desk. He got promoted. He actually did. His productivity increased, his attitude improved, his impact on other coworkers changed, and he got promoted at a very job that he was sleeping at. And when he came to me, he said, my number one goal, I want to ride the roller coaster at Kings Island. I'm too fat to fit in the seat. It's embarrassing. All right, well, let's get some weight off you. He said, I never knew what I was missing. And he said, I was missing out on life. Now, side note, his brother died. About a year after this, he came to me, he goes, you're not going to believe this. My brother just passed away from a heart attack. He goes, I was every big, if not bigger than he was, and he's dead. What changed in him, right? What are the odds of him going back to that ER for another cardiovascular event and the cost of his health care going up? He took control of it, though. He took control of it. He changed his lifestyle. That's all he did. And there he is on a roller coaster with his son, all right? So that's what he wanted to accomplish. He had a vision of his life that was much bigger, much grander, much more enjoyable than the one that he had. So what chance does this poor SOB have? right? This represents a lot of people that we know. It might represent us, somebody in this room saying, man, I want to lose weight, I want to get healthy, I have no idea how to do this. If I go on the internet, there's everything all over the place, high fat, high carb, low, paleo, Mediterranean, keto. What the hell do I do? How do I improve my sleep? How do I get my brain to function? What should I be drinking? Is coffee good or bad for me? What type of exercise? How long? How intense? If I can't get my sleep to improve, I'm not going to lose weight. How do I get my sleep to improve? There are ways, there's education to guide each one of these steps. How do I manage my stress? Turning on Dukes of Hazzard and sitting there for 2 hours eating nachos is not going to reduce your stress, okay? See, Dukes of Hazzard, you can tell how old I am, right? Anybody in this room that doesn't know that, you have to go to YouTube now, it's gone. Toxins. What toxins is he engaged in? Who's drinking from a plastic bottle? Everybody. Styrofoam cups? Everybody. Plastic sandwich bags. Keurig cups. Little Keurigs, right? Psh, fresh cup of coffee, loaded with bisphenol A. Awesome. These are the toxins we expose ourselves to. What about his hormone status? What about his thyroid, his insulin? These things aren't checked with great depth by your primary care. He loves you, but he was not trained to identify diseases and reverse them and prevent them. What about his mindset? And who's going to hold him accountable? Who's going to support him and check in every week and say, how you doing, man? How we doing? We on track? We all right? We good? Accountability means everything, and consistency. So, let me show you a few results and we'll bug out of here. This is Lori. Both of them are the same person. Isn't that amazing? Lori did a 6-month engagement, and she said, I'm going to change my life. These people come in typically with metabolic syndrome, and they say, I want to change my life. I'm willing and ready and able. I can't make you do anything different. I can't make you change your diet. I can't, and I don't want to. When you're ready, we'll take action, right? Lori said, my energy is better, my memory is better, I just can't believe it. I've learned so much about what I put in my body, and in fact, she used to be one of those lethargic people that just shuffled around the office, and she goes, you wouldn't believe it. Now all my coworkers call me the Energizer Bunny because I just buzz around and get so much done. Her life is more enjoyable. It's not about, I want to be in a bikini and on the beach. It isn't about, but when you get rid of inflammation, your brain is better, your sleep is better, your life is more fun. You can do things. This, Jeff, that robust, beefy looking dude, like he could kick your butt, his testosterone was low. It had never been checked. How do you know if you don't look? When we found out, we changed, he did the 6-month program, he changed his diet. But when testosterone comes back up, testosterone is not just erectile function. Testosterone has everything to do with muscle repair, bones and ligament, everything to do with cognition, energy, weight loss. If your testosterone is low, you're going to struggle to lose weight. Once we corrected that, guy lost 54 pounds in 6 months, and his cholesterol came down 60%. We didn't put him on a statin. We fixed his body, and his body fixed his cholesterol, right? Much more engaging. He used to go to bed at night. I correct that, not to bed. He used to go to chair at night because he had to sit in a chair to sit kind of in a partial upright position. Otherwise, the reflux would just kill him. Within a week of making the dietary changes that we recommended, and by the way, one of the biggest changes is we said, get rid of wheat. The whole room just pushed away and said, I'm not doing that. Get rid of wheat. He got rid of wheat, and within a week, his reflux was gone, and in his words, I was sleeping in bed like a normal person, okay? So changes can happen quickly. It doesn't take 6 months to see results. We take 6 months because it takes that long to ingrain a pattern, okay? All right, so at the end of the day, less risk, less cost. You have the ability, you have the control within your grasp, if properly educated and given some simple guidance and some accountability to change everything about your health. You can reverse type 2 diabetes, you can drop your cholesterol, you can come off medication, you can lose weight, you can get rid of joint pain. It's all in your control. It's within your power, okay? And that's the exciting part. You're not a victim. Your genes are not making you sick. Your genes are your genes, but they only account for 15 to 20% of who you are right now. 80% or more is, what am I doing to the genes I have? You have 25,000 genes in your body. Right now, only 10% of them are even working or turned on. Which ones you turn on and which ones you turn off is determined by diet, sleep, stress, exercise, toxins, hormones, all of this conglomerate that I've been talking about, okay? Hey, that's all I got. I don't think anybody fell asleep. So I made it. You guys made it. I'll take any questions you have. Any thoughts? Yeah.
What do you feel about nutritional supplements, mainly magnesium, vitamin D, and probiotics?
Magnesium, vitamin D, and probiotic. These are all things that I recommend for my patients. But everybody doesn't need to take everything, right? So there are appropriate uses. For example, magnesium. If my diet is high in vegetables and fish and seeds and beans, I'm getting lots of magnesium. But what
the
if...
soil is depleted of magnesium?
Not completely, but it's less than it used to be.
Oh, it's terrible.
So-
That's some, everybody says it's a myth, but it's not.
You're correct.
We're not putting magnesium back in our soil.
You're correct. So what you point to is that our farming techniques over time have reduced some of these nutrients in our foods. And so if I eat an organic version of broccoli, it has more magnesium than a traditional grown broccoli. Why? Because organic soils have a different protocol they have to follow. And you're right. There's less nutrients in our foods. And then on top of that, how many vegetables are we eating versus our great-grandparents, right? Huge difference. We're eating nachos and Doritos, and so we're not even getting the nutrients. So vitamin D, we live in Ohio, vitamin D levels are low because we get it from the sun. So oftentimes people need vitamin D. But yes, proper nutritional therapy can be very helpful.
I have noticed a big difference since I started doing that. I have neuropathy,
Okay,
and I got off of Lyrica, and I got off Celebrex. I take nothing for pain, and that's all I take.
awesome. Off Lyrica, off Celebrex by changing your diet, and there are other things that can be done for neuropathy. So yes, we do use nutritional supplements like red yeast rice and other things, fish oil, because they can have a profound impact if they're properly applied, okay? Anybody else? No other questions. I failed. I did not stimulate an engaging, riveting conversation. Yeah.
Can you give some examples of anti-inflammatory foods?
Anti-inflammatory food. So what happens when we eat bread and crackers and pasta, starchy carbs turn into sugar really fast. And then they cause a rise in insulin. That's an inflammatory process. Let's say somebody, you probably heard of the keto diet, right? It's very popular, it's in the media. A keto diet is an anti-inflammatory diet. I'm going to eat a high percentage of my calories from fat. 70% of my calories are from fat. That's heart attack in the making. No, just the opposite. Studies show that when we eat a high-fat diet, healthy fats, not French fries, not chips, when we eat healthy fats, when we metabolize fat as fuel and our cells get used to burning fat instead of carb, we make less inflammation. So a low inflammatory diet, there's many different versions of it, but take whatever your diet is right now, put on one side of the scale, crackers, pasta, bread, starches, rice, potato, look at that. And then look at the other side of the scale is how much vegetable do I get? And if you can change that ratio and increase the vegetable and reduce the carb, you're moving toward less inflammation. Okay, does that make sense? So a low inflammatory diet means a lower carb diet. And it's different. You're a lean guy, you look really healthy. But if somebody is overweight and diabetic, their restriction of carbs might have to be more intense than yours to get the same result. Make sense?
Yep.
Okay. All right. Hey guys, it's been fun. I hope you learned something new. I hope you share it with your family and your loved ones. But I hope you leave today realizing whatever health issues you may or may not have, you own it. You're in control of it. You can change it. You're not a victim. Your genes don't own you. You own your genes. You're talking to them. All right? And if you have any interest, we have information out front on many of the programs that we do. If you have interest, I would love to meet with you and engage that. All right? Thank you so much.
Huge thank you for Dr. Huber and for his staff for